All right, I'm joined today by Council Member Cisneros and Council Member Thomas, District H and District F. And then also Chief Acevedo, Chief Pena, and Dr. David Persse today. As you can tell, as you can see, I'm wearing this mask today. The focus is on the census. And the reason I bring it up is that with all of the federal dollars, resources that we need to combat the pandemic, quite frankly, it's all tied to the census. And right now, we're at about 52.5, 53% in response. The average response in the country is a little over 60%. And we're at 52, 53%. And so I want to encourage people to take the time to respond to the census, 2020census.gov. Online, 9 questions, doesn't take very long at all. Or you can call. I don't have that number with me at this point, but I will have it. So just want to say, today we will notice that, this Census 2020 mass, and next to keeping everyone updated to COVID-19, I just want to remind Houstonians of the importance of filling out your census form. And as of July the 5th, 52.5% of Houston's estimated 2.32 million residents have completed the survey, according to the most recent census data in Harris County. It's 9 questions. It takes only a few minutes. And for each person who goes unaccounted, Houston loses about $1,500, $1,500 per year in government funds for the next 10 years. So even a 1% undercount could cost the city of Houston $250 million in federal dollars for every 1% that we fail to count. And we need that money for education, housing, health care, and representation. So the census is critically important, especially when we are trying to fight COVID-19 and other pandemics that may come down the pike. Today, the Houston Health Department reports 412 new cases of COVID-19, bringing Houston's total to 26,012. Unfortunately, the number of deaths in our city will increase by 5, bringing it to 250. And the 5 newly reported deaths happen to be a Hispanic male in his 30s with underlying health conditions who passed away on June 29th. A black female in her 50s with underlying health conditions, May 24th. A Hispanic female in her 50s, again, underlying health conditions, June the 6th. A Hispanic male in his 50s, underlying health conditions, June the 21st. And a Hispanic male in his 70s, underlying health conditions, June 19th. So again, 412 new cases, 5 more deaths that we're adding to the list. The numbers are moving in the wrong direction for us. The COVID-19 virus in the city, quite frankly in the state, is out of control. And what we do today and over the next few weeks is critical to getting this virus back in a manageable state. And the goal for us is to bring the number of cases that we report on a daily basis. The goal is to bring that number down below 300. And I cite 300, that's the number I'm using, because it makes it then much more practical for us to engage with our contact tracing, okay? So we need all of these components to be working together. And so the goal for us is to bring that number that we report every day down to under 300 over a 7-day period. Okay, not just 1 or 2 days. And then that will help significantly and allowing our hospitals what they need to be able to handle any particular person that may need medical care. We continue to do robust testing at our 2 free testing sites in the city of Houston. The capacity is at 650 at each site each day, and both of our sites at Butler Stadium and Delmar Stadium reach capacity, quite frankly, still around 12 or 1 o'clock, and we have to stop testing people. The ICU bed usage, again, we are now in phase 2 with regards to the Texas Medical Center. The next 13 to 14 days will be very, very important, and that's why it is highly important for us all to do our part to flatten the curve, to engage in social separation, to wear these masks. And as mayor, I will continue to ask people to stay home as much as possible, to work remotely, especially if you are sick, please stay home, or if you have underlying health conditions, please stay home. Wear a mask. Remember that many people who have the virus never show any symptoms, and that is why it is important that everyone wear a mask, so mask up. I want to talk about a new testing location we made mention that will be taking place on the east side of downtown in District H. And let me just bring up Council Member Karla Cisneros to talk about that testing site.
Yeah, this is very exciting news for the second ward. There have been requests for some time now requesting a testing sites. We know we're hearing the data about the at-risk populations and the vulnerable communities in the Hispanic and neighborhoods. So all across District H, which is about 76% Hispanic, I'm hearing requests for testing sites, and I'm just so delighted to be thanking the Houston Health Department, thanking the Houston Community College system, and UMMC for coming together to locate a new site. Mr. Mayor, I'll call him Sylvester Turner did spill the beans yesterday, but it will be at the Felix Fraga campus, at the HCC campus along Navigation in 2nd Ward. It'll be one of the new sites that will be in place next week, beginning on Monday. So special thank you to President Melissa Gonzalez, who's been working with me for the last couple of weeks, and big thank you to Director Stephen Williams, who's been a close ally in making this happen too. I really appreciate that. And of course, we're grateful for the medical providers, UMMC. Thank you, Mayor. I look forward to having more sites too.
Thank you, and that's the HCC on Navigation. That testing site will start up on Monday. I want to thank Councilmember Karla Cisneros. She was very, very helpful in communicating and working with UMMC and making that happen. She didn't quite say that, but I want to thank her because without her support, that would not be happening. So thank you, Councilmember, and so that site will be available. It is important to mask up, to take this virus very, very seriously. I know District F has been impacted as well, and that's represented by Councilmember Tiffany Thomas. And so let me ask her to come forward to amplify the message for her people in the district.
Thank you so much, Mayor. The zip code 7736, 77072, and 77099 are leading the city in positives in District F. So historically, we've been known as the forgotten district, and I can tell the residents that are listening, we are forgotten no more. Working with the Houston Health Department, we will have a mobile testing site at Collins Elementary on July 18th in partnership with District J, my colleague, Councilmember Edward Pollard. We want to make sure that those who do not have an access to a car, that they also will have walkable access to be tested as well. In addition, we're working with the city, the Houston Health Department, and Alief ISD to have mobile testing at Alief Crump Stadium. More details to come. I just want to let you know that we're doing everything that we can to make sure you can be tested, have the PPEs, have the food, and the access to the information. More details to come. And so we're asking you to participate in the opportunity that we're offering. Thank you, Mayor.
So as you can see, this is an all-court press. Okay, this is an all-court press throughout in our entire city, because that is what it's going to take in order to slow the progression of this virus. Now, let me bring on Dr. Persse to amplify that message. Dr. Persse.
Thank you, Mayor. We can't underscore the importance of testing so that people know how to protect themselves. I just want to point out that the mayor reported an additional 5 deaths today, and we continue to hear about the deaths. And I'm also hearing people say that they don't understand why this is such a big deal, because there aren't that many deaths. So yesterday we talked about, don't forget all the people that are in intensive care units. I'd also like to point out, we have a slide I'd like to ask it put up, that there's a distinct possibility that there is an undercounting of the COVID-related deaths. In order for a death to be recorded as COVID-related, the death certificate needs to have something from the physician indicating a COVID-related illness, and then of course the process goes through, but that's how it gets recorded as a COVID-related death. If you look at this graph, and yes, it looks pretty choppy, but what you're looking at is the number of times per week, this is weekly data, that the Houston Fire Department responds on scene and finds somebody who's not breathing and doesn't have a pulse. Some of those are DOAs, and some of those are folks that we try to resuscitate. But week over week, usually you'll see where the orange line is 2 years ago, the gray line is 2019 last year, and the yellow line is this year. And you'll see the beginning in March, that line is going up and up and up and up. And so some of those are folks who are dying. Well, they're by virtue of the fact the fire department is being called, these are people who are dying at home. And then in many of these cases, we're trying to resuscitate them. And in many cases, they are already dead on scene, and we don't attempt to resuscitate them. So there is a possibility that for those of you who are looking at the number of COVID-related deaths and saying, well, the number's not bad, it may very well be an undercount. And our colleagues in New York saw the same phenomenon. So if you look at New York City, the number of expected deaths that they would have had, and you add on top of that the number of known COVID-related deaths, and then you look at the actual number of deaths, it was even above that. So there's this delta of deaths that occur in communities that have COVID spreading that aren't necessarily being counted. So let us not for a moment think that because the number of deaths is small, any death is tragic. One is too many, we know that. But for each of those families, this is a life-changing event for the survivors. And everyone who gets infected with the virus, probably unintentionally, but was infected by somebody else. And we have the ability to stop that from happening. Wear a mask, stay 6 feet apart, don't go to large gatherings, and clean commonly touched surfaces.
Thank you so very much. And it's so important when people are, if you're not feeling well, please don't hesitate to call. Let me bring up Chief Acevedo to speak for the Houston Fire Department EMS. What did I say? Did I say Chief Acevedo? Well, you used to stand over here, and you used to be over. Oh, y'all confusing me. All right, Chief Pena, Fire Department EMS.
Thank you, Mayor. Good afternoon, everyone. So we are still dealing with the staffing challenges that we've been discussing, but the numbers are going in the right direction. Today, we're reporting 234 firefighters in quarantine. We have 79 that are positive for coronavirus. And again, that's a far cry from what we saw just 5 days ago, where we had over 300 firefighters in quarantine. So we're moving in the right direction. I want to take this time, Mayor, to voice how much we appreciate the hard work that our first responders, firefighters, paramedics, police officers, everybody on the front line is doing in response to this pandemic. But certainly, the work that our firefighters are doing is incredible. They're running over 1,100 calls for service each day, and they're doing it being extremely short-staffed. So I want to take this time and let them know how much we truly appreciate the hard work that they're doing each and every day. I also want to take some time to acknowledge our fleet maintenance personnel. They are doing enormous work in keeping our units in service, especially right now in the middle of summer with the heat and the issues that we normally face each year with our air conditioners, with our service, our units out of service. They're doing an enormous job in keeping these units in service, and we appreciate their effort, and our firefighters appreciate the effort. In regards to the occupancy task force, Our inspectors and our arson investigators are still responding. Yesterday, in the last 24 hours, we had 71 calls for complaints, no referrals to TABC. Again, that's to the hard work of our inspectors and the cooperation of the business community. Again, we're working to provide education and voluntary compliance to provide a safe environment for their patrons, and we appreciate their help in that. As Dr. Persse mentioned earlier, we are seeing an increase in the number of DOAs that we're responding to. Just 3 days ago, we had the highest number that we've had all year at 18. 18 DOAs. That's people that we respond to 911 because they're having critical medical emergencies, and there is nothing that we can do by the time that we get to the scene. I want to stress to this community, do not wait to call 911. If you're having cardiac issues, respiratory issues, signs and symptoms of a stroke, any of those, call 911. Call 911. We have our ambulances are staffed, our fire trucks are staffed. We are there to respond. Do not wait too long, because this number and this data is not moving in the right direction. Those that have high blood pressure, diabetes, heart disease, any of those underlying symptoms, you are more susceptible if you contract this virus to a bad outcome. Do not wait to call 911. We would much rather we take you to the hospital where you have a fighting chance of surviving this than a tragedy of not making it because you wait too long to call 911. Okay? That's my report. Thank you.
Chief Acevedo.
Thank you, Mayor. Good afternoon, everyone. As of today, we have 219 sworn members of the department that are in quarantine. 165 of the 219 have already come back positive for COVID-19, and 54 are pending results. We have 17 of our civilian teammates that are in quarantine, including 13 positive and 4 pending. We have had 141 sworn members of the department that have been positive and have returned to work, and 7 civilians that are positive and have returned to work, for a total of 148. And since the beginning of COVID, Mayor, we've had 306 members of the department that are sworn members, 306 total that have come back positive, with 20 civilian members that have come back positive. We have 1 sergeant who's on a respirator, and we have 2 other employees that are hospitalized right now with COVID. So we would just ask everyone to just keep lifting them in prayer, and everyone in our community, extended community here in Houston, in prayer that is out and battling this disease. So thank you, Mayor.
And then lastly, I want to highlight another department, that's solid waste, because we have noticed some slowdowns on the pickups. I want to explain in part why. With respect to solid waste department, 73 employees were referred for screening. 21 have come back positive, which means that's more than 600 lost employee work days. All department programs services have been impacted. Employees primarily are contracting this virus, not necessarily from the workplace, but from the community itself when they are away from the workplace. So that's 73 employees in solid waste alone that have been referred for screening. 21 have tested positive. So that is causing some slowdowns with respect to our pickup, and so we are having to supplement those services by using outside vendors. So I wanted to kind of give a perspective on that front. Again, it's so important to get on top of this virus. We got to do it together, collectively. Everyone is impacted, not just people who are infected by this virus, but people who are suffering from other conditions as well. So that's why we're all in this battle together, okay? You may not be suffering from the virus, may be suffering from someplace else, something else, but if we work together, we can get on top of it.